infertility and role of intrauterine insemination. Good morning everyone, this is my credentials and these are the two QR codes that give you the insight of my orchid and YouTube ID. Those who want to scan, welcome to Baroda. The moment child is born, mother is also born. She is there, mother is something new, said by Dr.Manish. With the blessings of mother of mine, 3 book written by me is recommended in Royal College. Textbook of fetal echocardiography and textbook of IUI made easy, going for second edition. I am editor-in-chief of 2 journals and recently I had taken interview of Professor Herman Tourney Ashray. You can see that interview on this YouTube channel. What is male infertility? If you define, male infertility is when male has reproductive issue and affects the ability to conceive. That is a common man's definition. What is the scientific? Abnormal sperm parameters or inability to fertilize the ovum. If we see the incidence is all about 30 to 40% of all couples, those who are facing infertility. Prevalence of infertility, particularly of male infertility, is 15%. It causes psychological, emotional and social stress, and believe me, it affects the quality of life and relationship of husband and wife. There are so many different causes of male infertility, including sperm production, sperm function, inability to deliver sperm to the ovum, and sometimes unexplained infertility. If you see the parameters of semen production disorder, either in form of oligospermia, teratospermia, azoospermia means no spermatogens, or asthenoazoospermia. Sometimes there are anatomical issues like varicocele and obstruction or congenital absence of vas. Now see more and more patients like this because patient has got cystic fibrosis. If there is no hormonal proper production from above, that is hypothalamo-pituitary ovarian tissue or testis axis, then there is a hypogonadism or that is affecting the sperm production. God has given sometimes difficulty in the chromosomal arrangement, so there is a Klinefelter syndrome and Y-chrome microdeletion. Nowadays, there is one article in YouTube that now in next generation we have to search for male because Y spermatozoa is declining. Am I right, sir?
Yes.
You also believe that?
After 100 million years.
After 100 million years. So we are proceeding around 98 to 98 million. last million remains. Why there is affection of male infertility? Because of lifestyle. Previously, we don't want to ask the history of smoking, alcohol, cannabis, hashish. Now we have to ask this history to each and everyone. Previously in the society only 1 or 2 men has got all the vices and they have got only wifeys. But now the wife with vices are there, so you have to ask about all the vices. Do you smoke? How many cigarettes you are smoking in a day? Because just in the morning we are taking tea in the tea post just near to this Kalagoda and we see so many females they are smoking the cigarettes. So it is the scenario of today, so we don't have to search for vices, we have to ask for vices like smoking, alcohol, recreational drugs, and because of all these vices, obesity comes in abundance. It also causes sperm formation abnormality and it gives psychological stress and reduces the sperm motility. Recently we have got very good flood in your Baroda. It also affects the environmental factor. It also causes infertility in the male. Whenever you want to diagnose male infertility, always ask the history. Here the Bible comes. Love your neighbor, give thou your ears. Take the history properly. 90% of cause of male infertility you find in their history. And what is history? Is study of past in light of presence to have good future. So always take good history. Simple thing, you have to go for semen examination. If required, go for hormonal testing. If required, you have to find out the cause, the genetic causes. You can take the help of ultrasound like sonography and transrectal ultrasound, and if required, go for special tests. What are the treatment options available for male infertility? First and foremost, lifestyle changes. Give them the healthy diet. It is very difficult to advise them to go for healthy diet because now generation is very good acquainted with Zomatos and Swiggy, and you know how many healthy diets they are giving to us. Stress management. That's why there is a very good management of yoga, stress busters are there. There are nowadays stress gurus are also available. because they have undergone so much of stress. Now they are giving the stress relief medicine to all this our people or young generation. If required, you have to go for hormonal therapy, believe me, clomiphene citrate and HSG or human coronary gonadotropin is very well working in patients with hypogonadotropic hypogonadism. If required, you have to go for antibiotics, and if you want to give something to our patient, there are lots many cocktails available with all antioxidant, vitamin C, coenzyme Q10 and astaxanthin and everything, or micronutrients, they are available in the market. If required, we have to go for surgical vasectomy, that is Pandora's operation. If he has undergone vasectomy, then we can go for sperm vasectomy reversal. And if you are very much acquainted with ART technique like Tese and Messe, then you have lots of Pese in your hand. Okay, so use that technique very good. Second part of my talk is intrauterine insemination. What is IUI? That is IUI. You give me your I, that is semen. It is the only seed that contains he, that is semen. It is produced by he to she to make her he or she. Okay, so that's why they are giving us semen, and we are taking the bypass. We are bypassing all the factors of vaginal factor, cervical factor, uterine factor, and we are delivering directly right at the site of door of fallopian tube. Why? Because ovum is resting in the garden of ampulla. Ovum never travels. You have seen so many girls outside the male boys hostel, or so many boys outside the male hostel. Okay, so girls are staying there in the ladies hostel and boys are moving here and there. Life is like a race. 3 idiots. Life is like a race. One sperm has to reach to a beautiful ovum. So there is a race. So we are giving them at the entry door, and they will reach the ovum at the right side in the garden of ampulla to fertilize that ovum. And believe me, ovum is also unigamous. It doesn't allow second sperm to go inside. So once one sperm is there, it will shut down that door, and there is a fertilization process occurs. Those all who are doing IUI, remember you have to take ART level 1 certification. Without doing that, if you do an IUI and somebody will come from ART side, or now there are so many ARTs, body members are there, and they are just coming like hand grenade in the hand of rabbits. You understand? So all those who are practicing IUI, believe they have to take permission from ART level 1, and if you are doing IVF, then ART level 2 permission should be there. There are definite indications for IUI because of low sperm count, motility, unexplained infertility. We are discussing after 1 hour in this all very detailed. You are bypassing the cervical factor, and it is a boon to the patient, those who are azoospermic. We can give for donor IUI insemination. When what step by step comes, I always remember my first 4 books published by step series. So to go by step in intrauterine insemination. When we are going for IUI, our purpose is to have a controlled ovarian hyperstimulation. We are giving ovulation inducing drugs in form of letrozole or clomiphene citrate. If you want more follicle, more number of eggs, start clomiphene from day 3. And if you want to increase the number of follicle in that particular cycle, they start clomiphene from day 5. But in all these IUI cases, we are starting clomiphene from day 3, likewise letrozole. Letrozole gives us a monofollicular growth, while clomiphene gives us a multifollicular growth, and we gave them very good induction. We have to monitor by estradiol and ultrasound, and when ovum becomes 18 to 19 mm with endometrium 8, with very good perivascular flow, we have to give trigger, and with this trigger, then we have to go for IUI. In IUI, first we have to take the semen collection. Usually we are not giving more than 2 to 3 days of abstination, and they are giving a sterile container. Timing is usually after semen collection, we are giving 1 to 2 hours because sometimes liquefaction may take 30 to 40 minutes. And there are alternative methods when they are not able to produce in the hospital. We are giving them the vibrostimulation and some material that they can arouse themselves. They can arouse themselves, and they can use the facility of IUI in our premises. Once semen collection is there, after collection of semen, we have to process the semen. In a semen preparation, we are usually taking double density gradient preparation. We can use single density gradient also, depends upon the sperm count. Our objective is to take very good motile sperm. We should avoid all the non-motile sperm debris and seminal plasma, and with high motile concentration of sperm we have to inseminate. Usually we are taking double density kit. There are two methods of producing that material. First you have to take upper layer and then procure lower layer downstairs, or you have to take upper layer, lower layer first and gradually lay upper layer over there. After 2 ml of collection of that material into the same this 15 ml conical flask, then you have to overlay with the cement. Then give them 1200 rpm for 20 minutes. After 20 minutes, you will find a very good pellet here. Remove all the supernatant. Again put the enhanced media or fertility preserving media. Then you have to move again for 5 minutes, again with the 1200 rpm. Then lastly, this collection you have to take with a sterile IUI catheter and put it into the technique. So this is mix cement well, discard the supernatant, take the planet and again do the final. This is all the collection methods. Then again step by step you have to inseminate. Timing usually 24 to 36 hours after the trigger. Usually take woman into either your operation table or lithocal gynecological chair or very comfortable situation. Clean the vagina with normal saline only. Sperm doesn't like to have spirit. Men and women like to have spirit, but sperm is very against the spirit. So if you use alcohol, they will die immediately. Likewise, betadine, don't use them. Use the soft catheter, but depends upon the type of catheter you are available in your clinic, and you have to see that how much length is there. If you are required rigid or soft catheter to do IUI, inject sperm gently into the uterine cavity. Usually rest is not required, but our system is there. Everybody would like to take rest for 10 to 15 minutes, and they or she can resume activity afterwards. Immediately post procedure, sometimes some women have got cramps. That you have to say this is very normal, and you can prescribe any dicyclomine or anti-spasmodic for that, and you have to advise them and give them the hope that after 15 days you come with positive pregnancy test. So IUI is bypassing the cervix and bypassing the uterine factor, and you will deliver very good result to a patient in cases of mild male factor infertility. If somebody has success rate, it around 10 to 20%. Role is very good because it is less invasive, less costly compared to IVF. It has got limitation compared to IVF and ICSI because it is little bit costly. If female partner age is less than 35 with good ovarian reserve, believe IUI success rate is 10 to 20%. And if the sperm quality is more than 5 million per ml, number of IUI cycle usually we limit in our space at 3 to 6. You have to use very good ovulation induction protocol and times of insemination, collect the semen, and you have to deliver at 24 to 36 hours. IUI is less invasive, IVF has got high success rate, but if you have got very good or very less count, severe male factor, then ICSI is the answer. ICSI is not arranged marriage. ICSI is arranged marriage. By force we have to, IUI may be a love marriage, but ICSI is a forceful marriage. Whenever we are putting our needle into the sperm usually say, no, I don't do it. I don't want to do it. If you see every embryologist will try to talk with their sperm. Now beta, I am taking you for the shadi. You come, then we cut the tail. If you don't believe, you have to believe to do the shadi permanently. In mild oligospermia, results are very good with 2 cycles. Asthenospermia, you may have to go for 3 times. So in conclusion, understanding male factor infertility is very crucial, and IUI gives you very good help. Main need is difficulty because they are necessary to enjoy the success, and success always comes with your paper. 114 publications there and work it, and if you are lucky, then company will make GIF of you. So at the end, everybody should be happy. Give me some voice. Voice. The time to be happy is now. And the place to be happy is here. And the way to be happy is to make someone happy and have a little heaven right here. It is our duty with the help of IUI. We have to make all our patients pregnant. Oh my God, thank you. Happy is now.
Thank you, sir.
And the place to be happy is here. And the way to be happy is to make someone happy and have a little have right. Thank you very much. I stick to the time.